Yeah, so advice that I would give for healthcare professionals and Macmillan staff in cancer information centres that are looking to deliver or to improve the regularity of the delivery of this programme is working with managerial boards and with other healthcare professionals within that hospital area or the oncology area to really have it built into the referral system. The best situation would be to have it built into the pathway so that when patients get to discharge of treatment, it's automatically part of their pathway and patients are referred on to the HOPE course. That would help improve it be delivered more regularly, and what we found is that healthcare professionals, for example oncology consultants, cancer nurses and GPs are more likely to want to refer onto this course if it's delivered regularly. So if it's only delivered once or twice a year, they're less likely to refer. However, they do find that it does meet needs, it does reduce healthcare resources and it reduces the amount that patients are coming to them. So they would like to have it to refer on to. So it's just about trying to get it to be run more regularly. Now, one of the things in terms of patients, 94% of patients that have come on the course have said that they would recommend it to other patients, and so speaking to them, they do urge other patients to go onto the course, go to your local cancer information centre, see if it's running there. And we do get quite a lot of patients and carers who want to give something back, and they actually can train to become a facilitator and to support the healthcare professionals and Macmillan staff that are running the course and try and reduce some of that burden and work together. And patients who go on the course do actually find that the course is better if it's run with a facilitator that's a healthcare professional, Macmillan staff, and a patient or a carer that knows what it's like, what they've been through, and can empathise with that process. One of the other things that has really been beneficial, one of the most successful areas, is in supporting patients with their return to work. So it was a face-to-face course, it's run during the day, and so there are some people that can't come onto the course in that setting. But when people try to return to work, Macmillan have found that if they write to the employer and say that it could be part of their phased return to work, currently no employers have turned that down, and so that's been a massive thing to help people who are working to actually come onto the course. And one of the other things is there's sparse areas, and some of the areas that have been delivered to, and this is really key for implementation, not just for this course, but for implementation generally in cancer or long-term condition work. Some areas are dealing with quite large populations, quite different populations, so patients that can't travel, for example. And so one of the things that we've done to respond to that is we've also developed an online version of the HOPE course as well as this face-to-face version, which is now currently been piloted and is now being licensed as well with Macmillan. So that can offer a bit more choice and try and reduce some of those inequalities.